Hello there, Herle Burlyites. For so many of us in home isolation, this pandemic has taught us to be resourceful in ways we couldn't imagine before. How many people out there have become expert bread makers, algebra teachers, avant-garde TikTok filmmakers? But what happens to Canadians who don't have a home? How do they cope and get the help they desperately need, especially medical help? Our presenting sponsor, TELUS, is helping by supporting community health partners to repurpose existing mobile health clinics provided by TELUS Health to help manage the spread of COVID-19. The program was originally set up to help Canadians living on the streets receive the medical care they desperately need, over 20,000 patient visits a year. Now these mobile clinics are providing COVID-19 assessments for the homeless and marginalized in communities across the country, and helping to reintegrate homeless Canadians back into the healthcare system through the use of TELUS Health technology such as electronic medical records. In the words of Dr. Chris Steingart, Executive Director and founder of Sanguine Health in Waterloo Region, Ontario, maintaining frontline health and support services to the homeless and precariously housed in our community is absolutely essential. This funding will help ensure that Sanguine Health and our partners can continue to provide much-needed care during these unprecedented times. As we all adapt to our new normal during this pandemic, it's more important than ever to #stay strong, stay connected. Visit telus.com/stay connected to learn more. All right, welcome to the Herle Burly, everyone. I appreciate you spending a little quality self-isolation time with us when you could be doing so many other things, like watching Tiger King on Netflix. For our Tiger King Herle Burly crossover listeners, all 4 of you, you'll be happy to know that I've been thinking of dyeing my hair, renaming myself Herle Exotic, and opening up a sanctuary for wild red squirrels up here at my cottage. Sorry, it's been a long quarantine. I'm just trying to hold it together. We've got another 2-part pod for your pandemic listening pleasure today. For part 1, we have Pat Armstrong joining us. Pat is a sociologist and distinguished research professor at York University and a leading expert in eldercare. She, along with an international team, just published the report Reimagining Long-Term Residential Care in the COVID-19 Crisis. We're going to take a deep dive into that issue. How did we get to this horrible place, and what has to change from this point forward? For part 2 of the pod, we'll bring on our political panel, Jenni, Byrne, and Scott Reid, to pick up on that conversation. Plus, we'll discuss whether Ford, Trudeau, and Tory are politically indestructible post-COVID or just the opposite. We'll ask the question, why are we not asking better questions about China? And we'll dive into our listener mailbag for a couple of your questions. Pat Armstrong, thank you so much for joining us on the Herle Burly today. It's a great pleasure to have you here. How are you doing? It's been 2 months now since we've all been quarantined up. How are you holding up?
Well, I've been very busy talking about long-term care. Let's hope that can lead to something better.
Are you finding yourself in demand these days? People want to hear about this subject?
Yes, and people want to tell me about their experiences. And I've had an enormous number of emails from people wanting to be able to do something to make this better, or telling me their stories about their mother or their father or their aunt in long-term care. So it has been busy.
When they ask you how to make it better, what they can do, I want to get into all the substance, but I'm curious, when somebody says to you, what can I do to make it better? What do you tell them?
Well, I tell them that there are a number of health coalitions across the country, a national one, and in most provinces, or organizations like Friends of Medicare, community organizations, where they can get involved at a local level to try and make a difference there. We got the Canada Health Act as a result of those kinds of community organizations, as well as a lot of other kinds of groups. But it was very important in terms of getting us Canada's best loved social program. If we can get a good social program for long-term residential care out of this, I think that would commemorate the people who have died as a result of this.
Tell us about this study. It's international in scope. It's being done for the Canadian Centre for Policy Alternatives. What else can you tell us about it?
It started, well, this particular study started 10 years ago. It's international. It was funded by the Social Science and Humanities Research Council of Canada. And we did two kinds of research, the traditional kind of looking at statistics and policy documents, that sort of thing. But what we also did was take teams of 12 to 14 people into a long-term residential care home. Each of those teams were interdisciplinary, a whole range of everything from doctors to philosophers and historians. And they were also international. So each team had people from the 6 countries that are involved in our project. And we interviewed and observed over a week in 27 different homes in these 6 countries. So we got a very intimate, detailed picture of what we saw and heard. And we spent a lot of time together talking about what we saw or heard, or what we didn't see, or what we didn't hear. Because it's often what's missing that is as important as what is there.
Right. So my experience has been that people aren't very familiar with the conditions in these homes, and that this crisis in the homes during this pandemic has brought that to light for a lot of people. Maybe you could just expand for us, pre-pandemic, what was it like to live in one of these homes?
Well, it depends. It depends on where the home is. It depends on what the structure of the home is. There's a big variety. We were looking for what we call promising practices that were good ideas worth sharing, that would make things as good as they could be. And so we were looking at places where we thought we could get good ideas. And to find those good ideas, we talked to unions, we talked to community organizations, we talked to policy people, and we looked at the sort of quality indicators that are provided in many places for these homes to try and find a home where there could be some good examples, some effective examples. And we did see some good homes. So, for example, in Norway, we were in a nursing home that was physically integrated into the major town swimming pool, cinema, rock climbing wall, cafeteria, daycare center. All of these things were in one giant building, which really worked very effectively in terms of allowing the people from the nursing homes to have some stimulation outside, and also meant that the community came to them and they could watch and see the community in various ways. They were all private rooms in this place, and each room had direct access to the outside. And that was very important too. Well, but within our group, we've had big debates about whether they should be all private rooms. There's been a lot of talk during this pandemic in Canada about how they should all be private rooms. And I think it's quite clear we shouldn't have 4-bed wards, that is way overcrowded and just doesn't work in terms of the social as well as the safety aspect. But sometimes private rooms can be lonely. So in Norway and Sweden, where they had
and that's
all
a big issue in long-term care homes.
Absolutely. Well, and the Swedes and Norwegians on our team sometimes said, well, maybe you should have at least some double rooms for couples, double rooms for people who would get lonely. Because we've certainly been in some homes where there are beautiful private rooms, but people stay in them all day and are lonely. So the physical.
So that's a nice forward.
Sure.
Right. So that sounds like a beautiful vision for what a long-term care home could be, the one you visit. But back in Ontario in February, what was it like to be in extended care?
Before the pandemic, it depended on which home you were in. There's a wide variety of structures, wide variety in terms of staffing, wide variety in terms of the extent to which there is volunteer family involvement. So it depended, but I think we can say that no home in Ontario had enough staffing. That has been an issue for years. We hear over and over and over again, there are not enough hands. I think we haven't paid nearly enough attention to the food, to the laundry, to the cleaning. In many cases, we've contracted out that work. That, first of all, really fragments the labor force. It's hard to have teams when there are a whole bunch of different employers for the people who work in long-term care. Secondly, if you're bringing in food, for example, from outside to cook and chill, then you're really not providing the kind of food that stimulates the appetite and encourages people to eat so that they can get the aroma of cooking food, that sort of thing. So there were homes that cooked on the premises. There were homes that did have the cleaning staff and the security staff and the laundry staff all part of the same team. But that was getting less true before. And we, as I said, over and over again, we heard there are not enough hands. There's simply not enough staff. And one of the reasons that a lot of those family members are in the home for a lot of time is because of the gaps in care. And we haven't talked much about how a number of families have privately paid what are called personal companions to go into the long-term care homes to provide care because there were such gaps in care. And that was before people got sick and couldn't come to work. Staff couldn't come to work because they were sick or wanted to stay home because they were afraid that their family would get sick.
So can we just talk about the not enough people working, not enough staff in the homes for a second? Because we've had Charlene Stewart, the head of SEIU Healthcare, on the show to talk about this issue pre-pandemic. And I wonder whether when people hear that there need to be more staff in these homes, that they hear a union advocating for more jobs. What are the actual, what is not happening or happening because there's too few staff? What are the consequences to residents of not having enough staff?
Well, I think there are a lot of consequences. For one thing, I think that there's more violence because they have to do things in a hurry. They have to get people up and into the shower and out of the shower and back as quickly as they can. If you're dealing with someone who is frail, who has all kinds of complicated health issues and most likely to have dementia, that if you can't take the time to make sure that Mrs. Smith puts her left sock on first because that's what she prefers, then you could end up with violence. It means that you are not taking people to the toilet when they want to go to the toilet or need to go to the toilet because you just don't have time. And so what you do instead is put them in what are variously called adult briefs and diapers. That it means that you don't get a chance to walk them to the dining room because that takes too long because they walk so slowly. So you put them in a wheelchair. It means, and of course, the longer you spend in a wheelchair, the less likely you are to be able to walk. So it means a whole lot of things when you don't have enough hands in that room. It means that you don't have enough time to sit with someone and talk them into eating and make sure they eat and make sure they swallow safely, that you have a conversation with them because you have to get on to the next task. And so there's a combination of us not providing enough staff to do it and not recognizing that this is skilled work that takes time.
Okay, so now we're into the pandemic. What happened in these homes during the pandemic? Obviously, we can't generalize overall because some of them probably handled it well. But the vast majority of our deaths in Canada are in the long-term care homes. And you hear horror stories about staff that have abandoned their posts and people lying on floors or people dead in their beds for days. It just sounds like a horror movie. What was going on?
Well, I think you were already at the bare minimum of everything, the bare minimum of staff to be able to do this work that I was just describing. So then if you take even a few people out of that system, it becomes harder and harder to do any of the absolutely necessary things. And you don't get into long-term care in Ontario now unless you have extensive needs and most likely also dementia. And having someone with dementia means every task takes longer. And that it's even more important that these are familiar people. So if you take 5, 10 people out of the labor force during that time, then you're going to end up with people not eating or people not being changed or taken to the toilet or have their sheets cleaned or have a bath. And also, if you bring in extra people who don't have that training, it's very hard for them to come in and convince someone to eat or make sure that they eat safely, or unless they have the training and also the familiarity with the people. So I think it's not surprising in those terms. I think it's that we have no surge capacity in the sense of we haven't put in enough staff to give enough care in the best of times. So then when you get this kind of disruption, then it's not surprising, I think, that this happens. It also, of course, it makes a difference within a home if you have places where you can congregate some of the people who have COVID-19. So if you have a unit that if all of your units are 30 to 35 people, as is the case in some homes, then it's really hard to separate out the people with COVID from the people who aren't. But it's also about management, right? Does the management separate out the staff to make sure that part of the staff works with those people who have COVID and they're not then going into another room with people who don't? So there are a lot of factors, I think, but staffing is an absolutely necessary but not sufficient condition if we're going to deal with these issues, even on a daily basis, let alone in a pandemic.
Okay. We are still in the middle of this thing. I know that I'm anxious for an inquiry into what happened, and I'm anxious to move on to the things you're talking about in your study about fundamental structural change to this system. But people are going to die tomorrow and next week and the week after in those homes. What can we do right now to save lives in those homes?
Well, I was talking about some things. We need to congregate people and staffing. I think that the initiative taken in BC that we followed rather lately in Ontario of saying that you get full-time jobs and full-time pay if you stay in one home and don't travel among homes. I think that should include agency workers because a lot of homes hire agency workers. I think that we should have as many of the services provided in the home, but at the same time, we need to provide not just personal protective equipment for people who come into the home, but the kind of training they need to use that equipment and to know how to use that equipment effectively. And we also need to give them at least some preliminary education about what it's like to work in a long-term care home, because it's quite different from anywhere else.
Okay. I'm in politics. You're not in politics, but I've spent my life involved in politics. To me, this is not just a personal tragedy, but this is a political scandal. And what's happened in long-term care through this crisis. And what do you think the ultimate public inquiry will find?
Well, I think it will find what we've found for a long time in the research. I don't just mean us, I mean a whole host of researchers, a whole host of residents' councils, of family councils, of community organizations that have been interested for a long time in improving long-term residential care. So I don't think that there will be new news in terms of some of the directions we have to go in. I do think that there are things to learn from this particular infection, and because we're likely to have another one in the future, that there are particular things about preparing for a pandemic. I hope, though, that in doing this, we don't forget that this is a place where people live, and that our sole focus can't be safety. It also has to be making life worth living. As we heard in Germany, they wanted to put life into years, not years into life. So it has to be more than about surviving. It has to be about living. So I hope if we're going to have an inquiry, that the inquiry isn't exclusively focused on how to stop an infection, but also how to make these places positive options, good places to be.
Okay. Well, one of your recommendations is against private ownership of these homes. And I want to spend a few minutes talking to you about this. And let me start with, what are the current owners of the homes? And most of them are owned by 3 or 4 corporations, at least in Ontario. What are the owners of these homes like, and why are they in long-term care? I have, just to give you one bit more of context, as somebody that deals with companies, advises companies who are in the middle of crises, I have been stunned by the complete silence from these companies throughout this pandemic in terms of speaking to the public about what they're doing and what they see their responsibilities are as. And secondly, I have heard of not one example of one of these corporate owners putting more resources in or doing anything of their own volition to try to deal with this crisis as it has been going on. To me, it is stunning. Am I missing something?
I'm with you. I haven't heard a lot in terms of response and positive action being taken. First of all, I want to say that home ownership there's 3 forms of home ownership in Ontario. One is municipal, and there is legislation requiring every town of a certain size to have a municipal home. So it's, publicly owned. And then there are a significant number of not-for-profit homes that may be owned by, the Catholic Church or the Ukrainian community or whatever. And then there are for-profit. So 58% of those in Ontario are for-profit. And the big change has been in the direction you were describing, which is to corporate ownership. And I would say that one of the issues with corporate ownership is that it's really harder to have democratic control over corporate ownership, because their responsibility, surprisingly, is to their shareholders. That's their first responsibility. And they need to make a profit. And I think that is a problem in terms of democratic control, but it also may be a problem in terms of what kind of quality care you get. The theory in markets, as you know, is that you compete on the basis of quality and price. Neither of those operate in terms of long-term residential care in Ontario, or what are commonly called nursing homes. They're always full, and that most of the cost is paid for by the government. So it's not, the market doesn't work there. Now, the other argument is that the for-profits are more efficient, but there are multiple ways you can become more efficient, but if your main focus is on saving money, and it has to be said that focus has also been, to some extent, to be found in the not-for-profits and the municipal homes, then rather than on care, then you have just enough labor, you have just enough supplies, you have just enough everything, and that you get a crisis like this and exposes how fragile just enough is. And I think that we have lots of evidence about the lack of protective equipment. Now, partly we decided to put our focus on hospitals, and when you look at the SARS inquiries, their focuses were mainly on hospitals because that's mainly where it occurred. But there was still advice about having adequate personal protective equipment in these homes, and it's clear that that hasn't been the case. And I have been reading the cases that the SEIU and Ontario Nurses Association took against a number of the homes. All of the ones they took them against, at least that I read, were against for-profit ones. And that they were looking for injunctions to require them to provide them with personal protective equipment of the right sort, and to allow those people who are providing care to make those decisions about when they needed the equipment. And then they also were about congregating and about the need to put those people with COVID separate from other people. And they were about testing. And they were all arguing that less of that was being done. I think it'll be interesting after all this is over for an inquiry to look at what are the basic differences amongst the homes in terms of their capacity to deal with the infection. It was pretty hard to keep them out early on because we didn't know enough about who could spread it, what the origin could be, all of those things. But the real question is what happens after it comes in? And that's what we need to focus on, and also look at what are the patterns in terms of ownership as a result of that. What are the patterns in terms of wages, in terms of precarity of the labor force, in terms of contracting out services, all of use of agency workers, provision of equipment, a whole host of questions.
Why do we have to take the homes out of private hands in order to make that quality difference? Why couldn't that be done through serious regulations, rigorously enforced?
Well, we might be able to do that, and maybe the result of that would be it would no longer be an attractive place to invest. I think that right. If you said, okay, you have to pay everybody who works in a long-term residential care home at least this amount of money, that there would be a minimum wage for healthcare workers in long-term care. If you said you had to provide this kind of food that within the place, if we said that you have to hire the major labor force as full-time jobs, if we said those things, I think that it would become less attractive as a place for investment. And maybe they would disappear by choice rather than by force.
Well, that would be interesting. One of the reasons I asked that is because in addition to the quality issues that we have in these homes, we also need a lot more beds, right? We already have, as you said, a severe rationing of these spaces for people that are really in desperate straits. My research in other areas has led me to believe that we have an entire generation of people heading for retirement with little or no savings in retirement income. And so even more people in the future are going to end up needing to rely on publicly funded long-term care beds. So we're going to need a lot of beds built in this country. Can the government do that? Or that's kind of why I'm asking about if there's still a role for the private sector.
What is the cost of not doing it? You know, that's one of the things we need to ask. Are we really ready to abandon a generation of people as they age? When you look at the fully private retirement homes, their costs are beyond the reach of any of those people you're talking about. When
Right.
you're talking about something from 60,000 to 120,000 a year, it's more than my pension. I can't imagine what it would be like for most people. So a lot of people are going to need this care. Now, the response you get is often, oh, well, they can do home care. Well, let's look at the cost. I mean, why is home care cheaper? Because you shift the cost to the home. We can't provide 24-hour publicly paid for nursing care in private homes. That would be ridiculously expensive. And we also often fail to include the cost to, especially the women, and it's mostly women who provide that care at home, when it is provided at home, which also means that they may not be able to participate in the labor force, or if they do, only peripherally. But it also underestimates the kinds of skills that are required to do this work and the stress. Our current project is called Changing Places, which is looking at the transition into long-term care and what changes in terms of the work. And it's really quite striking that because of this shortage that we're talking about, that the stress on the people at home, and this, as I said, is mainly women, is extraordinary. And they're almost at the breaking point, and of course some of them are at the breaking point before they eventually get in bed. And often that bed is, 50 miles away or a long way away in terms of them connecting to the people in that home. That makes it harder for them to provide that other kind of comfort and support. So I think we have to not only expand the number of beds in the public sector, but also look at what are the alternative structures that we provide.
Okay. Let me ask you a difficult, challenging question, which is, before the pandemic happened, the great white hope of healthcare advocates in Canada was Pharmacare, was a national Pharmacare program. That was to be the next great extension of Medicare in this country. Assuming that government could not take on both Pharmacare and the public ownership and administration of long-term care and the expansion of long-term care, how would you prioritize those two things?
I'm not sure we have to make a choice, first of all. I think we could afford both. It's amazing what we've been able to afford right now. It's a matter of values. As Roy Romano said in his Royal Commission report about the future of healthcare in Canada, although he didn't look much at long-term care, it has to be said, he said, we can have as much healthcare as our values lead us to provide. And I think that...
But he knew that was wrong. Sorry to interrupt. He knew that was wrong. He knew that was wrong because when he was the Premier of Saskatchewan, for financial reasons, he closed 52 hospitals.
Yeah, but, it's also
true. Rural Saskatchewan.
It's also true that Tommy Douglas was leading a province that had the biggest debt, was the first to introduce universal hospital care. Sure, you can always argue that you don't have enough money, but Tommy Douglas also would say, when people ask me, where am I going to get the money? I'd say, from the people who have it. So, I think that we have had this mantra of low taxes, low taxes, low taxes. And when I talk about Norway, they have higher taxes. And they've also had higher royalties on their oil. And they've used that money to take collective responsibility for these, for things like long-term care and the coverage of Pharmacare, or what we call Pharmacare. So I think it's a matter of values. I don't think it's, and I think we're going to have to raise taxes after all this is over. But I don't think taxes are a bad word. It's the price we pay for civilization. So let's have a conversation about that. Are you willing to have a whole lot of older people die at home, on the street, in the home? or are we prepared to invest in that? And one of the costs in long-term care is also the drugs. So, if we're going to cover those drugs, I also think that we need to look carefully at the drugs that we prescribe and what we use. But I don't think that these have to be set up as choices we have to make in one or the others. Certainly we have to make a choice. We have to make a choice about where our values are.
I want to conclude by asking you what to me is the biggest question, and one of the things that would really have to change before any of this changed fundamentally, which is, why do we as a society place such a low value on the people who provide care in our society? So the people who work in the care business are the lowest paid people. They have no benefits. They treat it like crap in their jobs. And frankly, people providing care in families and in homes, we just don't value it the same way. And I'm not judging other people, because I had a couple of sisters who took care of my mom for a number of years, and that was a huge burden on them. It wasn't really reflected in our family, or spread. The burden of that wasn't spread broadly throughout our family, nor were the government supports for them in any way adequate. So it just seems like something that we shunt to side, expecting that, frankly, women will do it because it needs to be done.
Yeah, I certainly think there's a gender bias, heavy-duty gender bias. There's an assumption that it's unskilled because and that it's something anyone can do by virtue of her genitalia. And I think that there's no evidence of that it's something we assign to women, and that it's often assigned to women who have less power. So that in long-term residential care, for instance, that where the bulk of the work is done by what in Ontario we call personal support workers, are people from racialized and immigrant communities who have even less power in terms of responding to that. And so the gender issue is huge. And one of the first studies I did on long-term residential care was in 1988 for the Pay Equity Commission on what was going to happen in terms of pay equity in the health sector. And one of the areas was long-term residential care. And the pay equity legislation didn't really touch them very easily because they had no male comparator, because in this, the whole pay equity system is based on comparing yourself to men. Well, there aren't any. Well, there are hardly any. So, and it's interesting, most of the men that we've encountered who do work in long-term care are also racialized and or immigrant. So it's a less powerful group. It's women. It's something, and even women themselves sometimes say, "Oh well, I do just what any woman can do." But it's skilled work. I think of an interview I did with a young woman who had graduated from a recreation program and had gone into work in a long-term care home to do recreation. And I asked her if anything surprised her about the job. And she said, yes, I was surprised that I was expected to help people eat. And and she said, I hadn't been trained for that. So they gave me a training video, and all it did, she said, was terrify me. I was terrified that people were going to choke and die because I wasn't going to feed them properly, or they were going to get violent. And it's only on those kinds of occasions that I think we start to recognize how skilled that work is. Now, I think where there's been a bit of recognition during this pandemic that it's demanding. But even then, the demanding tends to be, they have to work 12 hours. Well, it's not just that you work 12 hours. If you are in a home where someone is saying, nurse, nurse, nurse all the time, and you're on your 12 hours of shift, that's an enormous amount of pressure. It takes skill as well as a lot of effort to be able to do that work. And it's a heavy duty responsibility. And it drives me nuts when people say, oh, women, this is care that used to be provided at home by women. No, your grandmother and mine never looked after catheters or oxygen tanks or the kinds of technology that is now available in the home. People didn't live as long. If they did live for a long time, they were relatively healthy. They didn't live with these healthcare complications. And we also ignore the fact that might have been bad care, right? Just because you're cared for at home doesn't mean that the care that was provided there, just like we know that there can be bad mothers, right?
Right.
Anyway, that's my little rant.
No, it's a good one. It's a good one. And I want to thank you so much for coming on with us today. This has been really, really interesting and really informative. You're very level about it. There's enough to be angry about here that you could have been really angry, but you're a very constructive person, I can tell. And I wish you the best of luck with finalizing the study, and I hope it has a lot of influence. This pandemic has, in a lot of ways, shown that we lead with our values when we have to, when we're pushed against it. And so maybe there'll be some reckoning here and some change.
I hope so. I hope we can come together to make a big difference. Thank you.
Yeah. Well, thank you. Take care.
Bye.
Bye. Folks, if we have learned anything over the past few weeks, it's that in times of crisis, governments matter. So if you've never heard of Queen's Park Today, it's one of Ontario's most trusted news sources for political insiders and for people who actually need to know what's going on at the legislature every day. Whether it affects your business, your stakeholders, or the health and safety of your family, Queen's Park Today is tracking the ongoing developments in Ontario. The newsletter arrives in your inbox first thing every morning, so you can start your day off already ahead of the game. The only way to get detailed, boots on the ground coverage that you need is by subscribing to Queen's Park Today. There's also BC Today and Alberta Today, which are great for people who want to know what's going on out west, but don't have the time to follow it closely. To get a free 2-week trial of Queen's Park Today, BC Today, or Alberta Today, go to politicstoday.news and hit the free trial button. That's politicstoday.news/free trial. Jenni, Scott,
hello.
The panel is back. Good to see you too after another week. How are you?
Good. I feel exactly the same way. I'll say the same thing I start every pod with. I am done with this. This lockdown has to end.
You're no worse though.
No.
You're not doing anything dangerous or harmful to yourself.
No.
I love your shirt.
I'm not having that much fun.
I love your shirt. It's a great shirt. For me today, it's a Clash day. London is drowning and I live by the river. So that's how I feel today.
I'm sporting the old Lee, Kirby, Heck, and Ditko. Little comic book nerdism there going on. God,
Well, who are those people?
Well, Stan Lee, of course, founder of Marvel Comics. Jack Kirby, the guy who did all the actual work, and fantastic, brilliant artist. And then Don Heck, did Iron Man in the early days, a little bit of the Hulk, and of course Steve Ditko, the super strange. You would like him. He was an Ayn Rand fanatic, Jenni. He was a strange guy. He kind of did a Salinger thing. He kind of went into hiding more or less for like 35 years. He died a couple years back. He was a weird guy, but he created Spider-Man. He created Doctor Strange. Mr. No, which is an awesome character, who's drawn pure in black and white, and he wears a black and white suit and sees the world through absolutism, and all things are black and white. There's a great comic where he actually saves a woman from a mugger, and then drops him.
This is going on a long time now, eh?
All right. Anyway,
Jesus,
these are cool.
Murphy,
I love the early
regret asking. Fuck. All right.
Basketball.
My book for today is The Northern Magus by Richard Gwynne.
Isn't it
Richard
Magus?
Gwynne was one of Canada's most accomplished journalists and worked for the Toronto Star and the Globe, I think. I don't remember that correctly necessarily. This book came out in 1980. And so it's a really good reflection of what the perception was of Pierre Trudeau before the 80 to 84 stretch in government. So if he had finished as prime minister in 1979, this kind of would have been the historical record. And it's really interesting to read and see how much of it is about image and style and performance, and how little of it is about substance, right? There really, other than bilingualism, wasn't a lot to the Trudeau record prior to 1980. So, Jenni, what's been interesting you in politics this week? What have you been paying attention to? What'd you laugh at? What'd you care about?
I don't think I laughed really at anything. In terms of politics, I think that watching the leaders' daily press conferences still, which as more and more, I know we've talked about this, the more they go on, the less interesting they are. Both Trudeau and Doug should start taking some days off, I think, and work on some stuff that they keep talking about behind the scenes, and then come out and announce it.
Trudeau's like us. He's run out of things to say, so he's dipping into the mailbag. Please send me your questions.
Jenni, we thought, and viewers, we had some tweets about this. We figured you'd go off on that whole Sunday afternoon. I used to be a teacher. As a teacher, send me your questions. I don't know. He's going to, Zoom into someone's household and help them with their math homework. I've got to hold myself between 2 and 3 today if he's free. But you're not going to go bananas about that? Come on.
But I'm not even going bananas about anything. It's just it's the hypocrisy of it. I think it's absolutely. It's dumbfounding to me, and I think that as the world starts to transition into dealing with the absolute economic fallout of the last 2 months, I think their patience for politicians coming out and saying nothing or making hypocritical comments is waning even more. And I think that's why you're seeing in some of the polling numbers. The mammoth, the Hugo Chavez type numbers that like Francois Legault had, for example, he's only at a small 77% approval now in the latest polls. But I think that people are you've got the prime minister saying nothing and just, creepy, tell your moms to leave the rooms, go on, mom, I want to talk to your kids. You've got, Doug who the media reported that he went to his cottage when he told people not to go to his cottage. He had his daughters over for Mother's Day, which, by the way, I have no problem with him doing either. The problem I have is with politicians who are hypocritical. He announced curbside started in Ontario, and the same day John Tory announced that he was going to shut down 50 kilometers of fucking roads in Toronto to make it harder for businesses to actually do curbside or restaurants to do delivery, because he needed to insert himself in that. So anyways.
It's not a real John Tory criticism from Jenni Byrne unless it mentions his hard-on. Now get in the game.
Well, he does. I still think he wakes up every fucking morning with a hard-on thinking about how he can limit.
There we go.
Yeah, how he can limit everyone's movement outside their homes. There you go. For you, Scott.
There we go. Our weekly John Tory Wood observation.
I'm not going to talk about that. But, I know, I like politicians that I can relate to. I like politicians that I feel like, hey, that guy's not so different than me. She just might be the same kind of person as me. So I like politicians who drink beer. I like politicians who talk plainly. And I like politicians who are raving hypocrites, because I am too. So I'm not going to register the same criticism of Doug Ford, because if I find out he's a hypocrite, I just think to myself, well, that's just one more thing that we have in common. I thought the most interesting thing about politics this week, because I'm superficial and I love catnip, is the speculation that the prime minister might bank these numbers and call a fall election. I don't really think he will. And I don't really think he will, because it's very important in politics to be opportunistic, but it's very, very important in politics to not be seen to be opportunistic. And I think that he's got to be very careful and couldn't go down that road. But I think if these numbers persist, you would have a reasonable argument in the new year to say, let's have an election. We are confronting a set of choices and challenges that no government has in the past 100 years. How are we going to manage it? What's the roadmap going forward? And I need a mandate, and we have differences of opinions between the parties. So let's lay it down and do it. But I think that's a March, April of next year thing, not a September, October thing. But hey, you never know. So I know it's kind of trashy
those numbers
to speculate,
will not
but I love
hold,
it.
Scott.
But they may not hold.
Those
but
numbers
they might.
will not. They won't. They won't hold. They're crisis numbers.
Yeah.
They're crisis numbers. Everybody has them that are really good, and they dissipate with the crisis. And as we've said, the next phase of this is going to be far more difficult politically than the lockdown phase. The other thing you got to be careful about is, like David Peterson, 1990, is call an election just as the tide is starting to recede. Right. So
but
you might
that
think
the argument for doing it. I mean, if you want to be really crass, I mean, if you're willing to sustain the criticism in the first few days, this is just craven exploitation of the electorate, might you not be better to bank these numbers now rather than find yourself in a George H.W. Bush situation where you had been looking at 91% approval, and then a couple of years later with a weakening economy, you get canned. So I'm not saying that's what I would advise, but, yeah, I think it's interesting. I think if you're in government, you got to say to yourself, we got to think about when the right time to ask people for a mandate is. It is a minority government after all.
Yeah.
Well, since you and I, Jenny, just wait a second. Since you and I, Scott, completely fucked up our minority situation, Jenny.
Well, you certainly did.
Jenny in 2011 found the perfect time to force an election.
Right.
And what would you be thinking about election timing right now, Jenni Byrne?
Well, if you remember, we were in year 3 of a minority government by the time the election happened, and the opposition brought us down. But it turned out to be a very good time for an election for us. I think right now, I think the fall would look too politically crass. But that being said, Trudeau is going to have to, if I'm him, I want to go to the polls before people fully realize how bad the economics are. So right now we're a country that has half our labor force has applied for the CERB. Out of the remaining half, 40% of them work for governments of some sort. And so practically speaking, eventually when we're sitting, next spring with a $1 trillion debt and a $300,000 or $300 billion deficit, the government is going to have to make hard choices. They're going to have to cut off CERB benefits. They're going to have to deal with like the restaurant and tourism and hotel sectors that will not have bounced back. They're going to have to cut government jobs. And I think that if you're Trudeau, you want to have another election under your belt before you actually have to start making those hard choices. So I'm kind of with Scott. I don't think it will be this fall, but I think it's probably something that the Liberals are having very serious conversations about. And also a plus for him on either side is we're going to just be out of a leadership race. So practically speaking, like not taking aside like the actual candidates and what have you, it gives the party, the new leader, very little time if they were to prepare, if they were to go in the fall. And Jagmeet Singh has now brought the NDP back down to like 10% in the polls.
Hasn't McCabe been calling for an election in the fall?
If he did, I haven't seen that.
Well, he better be careful not to put his head. He doesn't want to put his head in the Stockwell Day guillotine because that's exactly what happened in 2000 when Stockwell Day brazenly said, let's call this election. And Chrétien basically clicked his heels and said, you got it. I've been a bit glib about this, the way we've approached it and stuff. But in all seriousness, I do think there's a valid argument to be had about, because listen to the very points that Jenni was raising earlier. Before we get into the political analysis of it, right? We get into a position of reopening. How does the reopening go? What does it confront us with economically? What if it's an uneven reopening, which I think most people would suggest it likely will be? Maybe infection rates go up and down, and so on and so forth. I don't know that it isn't legitimate. Forget the politics. Wouldn't it be legitimate for a minority government to table a budget in February or March and say, there are differences of opinion here about how to handle this. This is our plan. We are going to sustain these programs. We're going to do these kinds of investments. It is going to mean that we will have higher deficits for a longer period of time and have to meet that challenge. But that's what we think we should do. Now, if there are others that disagree, let's have that argument. Let's set a path and let's let people pick. I don't think that's an illegitimate thing to discuss, to be honest.
No, in fact, put that way, you could argue that before launching into the recovery phase of this and all that entails, the government should have a mandate.
Except that you face this conundrum, which is that what Canadians expect from their political leaders right now is not politics. And so if you appear to be overtly political in your motivation, you're likely to get stung. So it's...
But that's where Trudeau will have to, that will be where the difficulty for the Liberals are. I think that I've said this, I know for the last few weeks we've talked about this. I think it's absolutely at this stage, we are in week 10 of this lockdown, and is absolutely critical that there be political debate, and that people can point out problems that they're having with the different programs. And I mean that on a federal and a provincial level. I think it was, the issue that I have with the Conservatives is because Andrew Scheer remains our opposition leader. He has no credibility, and ergo we can't get traction. The Ontario caucus decides whether they're going to kick Derek Sloan out of the party, and we've talked about this before, over his comments on Theresa Tam, which I don't agree with him questioning her loyalty to Canada, but we've talked about this. The Public Health Agency was created after SARS to be ready for a pandemic, and this government was woefully not prepared for this pandemic. There should have been PPEs, there should have been plans across the country, and those are legitimate questions that people have to ask of that people should be asking of the Prime Minister and of this government.
Well, Jane Philpott was pretty direct. She said it's just a low government priority. It's just, the recommendations were there, but it's always the poor cousin when it comes to funding. So there were decisions that were made or not made along the way.
But there were also decisions to ship 16 tons of PPE the first week of February to China, even though the World Health Organization said that there was an upcoming pandemic and countries should make sure they have adequate supplies.
Right.
That's a legitimate question of the government.
For sure it is. Absolutely. Now, getting back to this political leaders and elections issue, it's not just the case that they're more popular. It is also the case that in some cases, and Doug Ford is the most remarkable example of this, that the leaders are not just more popular than they were, but they're viewed fundamentally differently than they were viewed before. As we call it in the communications business, the frame around these leaders has changed. And as a consequence, the way they're judged by the public and by media has changed a lot. So Doug Ford, if this pandemic had come along in year one of his premiership, post Jenni Byrne, pre-Dean French departure, then a lot of the policy mistakes...
The glory days.
Yeah, a lot of the policy mistakes would have been laid right at his feet, as opposed to being seen as just sort of endemic to the system. And a lot of the things he's done, whether it's go to his cottage or have the kids over for a visit, would have been seen as hypocritical. He'd have been slammed for these things, but he's coasting through them because the new frame around Doug Ford is that he's an effective leader who's being nonpartisan and non-political, working with Trudeau and Freeland and leading Ontarians in a bully pulpit cheerleader way that is effective. So now Doug Ford gets away with shit he would never have gotten away with before. Correct?
I think every politician, regardless if the pandemic was last year or this year, and Scott said it earlier, when there is a crisis like this, when it's like, the U.S. in 9/11, like after 9/11, everyone gathers together until they don't. And that's where I think you're going to see the politicians, because for the first month and a bit, they wanted the kind of Doug Ford approach. I'm going to go out and just, I love you all. We're taking care of each other. I got the 14.5 million best teammates and we're all in this together. But as we hit into the 10-week mark, I think the issue Doug is going to have is that if you look at people are now starting to be critical. So we are the most locked down jurisdiction, I believe, outside of Montreal in the Western world. There's no seeming plan of opening up anything. We're striving to be we're basically where provinces like BC and Alberta and Saskatchewan were for their entire lockup. That's where we're at now. And if you're looking at the death tolls, they're a fraction of what the modeling 2 months ago said. And frankly, the purpose of the lockdown when it came in March was never to wait for a vaccine. It was to make sure that we stemmed the peak, so they flattened the curve, so our hospitals wouldn't be overwhelmed. Our hospitals have essentially not gotten above 60% capacity since this whole thing started. And I think you've got that. You've got the fact that the long-term care situation is still not under control. The government announced almost a month ago of the lockdown and the staff not going between homes, but yet the rates in long-term care homes continue to go up. And ultimately, in terms of the curve now in Ontario, even though we're doing more testing, the gross number of cases has actually declined. It was at about 5% of all those, tested at the start of this, and it's now at 1.5. So, 1 in 5 or 6 people that is. So I think that governments are going to have a problem in terms of, I think that these questions are going to become more pointed with people. And I think that it's funny if you look at what people would judge as conservative columnists or, conservative supporters, that seems for Doug, and for Doug's case, in essence, they have been the most critical of him. So, you and Scott may say he's doing a great job, but you'll never vote for Doug Ford ever. And I have conservative family who voted for Doug last time and are saying we're not really happy and we're not sure we're going to vote for him. That's going to be the challenge the PC part of Ontario Party has.
Man, what a tough club to please. Jeepers creepers.
Well, I don't think it's that tough to please. I think people want to start opening things up. And if you look, like we'll see, Florida has just 66 more deaths than Ontario. And everyone said it was going to be the apocalypse when they reopened, but they've got a population of 21 million and only 66 deaths more than what Ontario has, and they've essentially now been open for close to 2 weeks.
Jenni, you forgot that Scott and the Premier are on first name basis now. Scott's taken to calling him Doug, and he's been jollying him up in every one of these podcasts. Scott, Scott and Doug.
Hardy har. I will still not vote for Doug, but I won't vote for Doug because I'm mad that about the small numbers of recent deaths in Florida. I am going to not vote for him because all the other reasons I would not vote for him in the first place. But I just want to take one step back. I just think it's interesting to people who are pure political junkies, and particularly junkies of political communication. It is a reminder what we witnessed with Ford, and it may be a temporary phenomenon. It may pass for reasons that Jenni says, and for lots of other reasons, I am convinced for sure that the next stage of this thing as we go into recovery is much more politically treacherous than the stage we've been through. Not that it hasn't been difficult for political leaders, but by and large, as Jenni says, if you play team ball, talk about playing team ball, and appear as though you were regularly and consistently motivated by the public interest and not partisan politics, then you'll be getting pretty high marks across the board. This thing starts to go up and down in terms of infection rates. Reopening works, it doesn't work. People are chafing at the bit. What about the unequal regulation of this business sector versus that business sector? All those things could create issues that divide people and make it tougher for politicians. But on that core issue for our listeners and our watchers who are pure political comms junkies, we see the power of a frame. We see the power of a media frame. You're doing book club. This book is by our buddy, Bill Fox, who wrote this 21 years ago, this book, Spin Wars. And I love this book, right? And he talks in great, almost academic terms about the power of media frames and how that plays into politics. And we are in a world now where Doug has had two explicit examples of failing to practice what he preaches, and it falls off of him like rain on a green leaf. And it's really something to see. And so it's going to take some of those disruptions, like Jenni said, it seems to me, before it seems politic, or it doesn't seem impolitic, for media to start to hold him to the kind of scrutiny that they routinely held him to before. And it just goes to show you, once that frame gets established, how stories get funneled into it. And a story that reinforces that frame gets high play and loud volume. And a story that is inconvenient to that frame gets marginalized. And so, we're going to see the frame change on him again. And that'll be tougher. But he's in a good place right now. And if I was working for him, I'd be saying, what do we do day and night, particularly as we go through this next stage, to maintain this frame, to stick with this frame, to feed this frame, and not to watch this frame melt away?
Yeah, I agree.
That's not a point of disagreement.
Like I agree with you. Things are going well for him and most politicians. I just think that's going to. I think that is going to start to change. I think people, as I said, all of these measures and all of the popularity, they're popular, and these measures are working until they don't. And I think you're going to start seeing. We've talked about this before. A real schism between. People in terms of opening up and where they want to go. You see it in states like, Governor Cuomo is praised every day for how he's handling the situation in New York, and it's ground zero for the United States. Like their death tolls aren't getting any better, and yet the governor of Florida is bullied for opening up the economy, and they're sitting at less death rate than what we have in Ontario. So all I'm saying is, I just think this, to David's point, and he said this before, this isn't real. Like what is happening now, the public opinion, the polling for politicians, it is not real. And I don't think we're actually going to see where people really are at for another couple months.
It's hilarious to see people on Twitter doing seat projections based on these numbers, as if that's going to be what the election's like. But anyway, what about Trudeau? So if the pandemic has changed the way people see Doug Ford and the context in which they put Doug Ford, and started to appreciate some of his strengths more than they did, and started to ignore some of his weaknesses more than they did, what's happening to Trudeau? Is Trudeau's image different now than it was pre-pandemic?
Well, he's up in the polls, so one would say yes. Like the one poll that was out had the Liberals at 45% of the vote nationally. Like that's like election 2000.
Think differently about him?
I'm not sure if anyone it's the same as with other politicians. I think people just seem right now to be happy with how the government's handling things. I think the best thing you could say is how quickly they were able to get the CERB benefit out the door to people. I've talked to people that applied for it and got it within 3 to 5 days. That's something that's almost unheard of unheard of with government. That being said, when a large percentage of those people have to like pay it back, when taxes are assessed and what have you, that can change. So I think that Trudeau's falling into the same, like he's just, people are comfortable seeing him, and there's really been no opposition or no criticism of things that legitimately need to be that the government should be asked of.
Is he gaining more gravitas? Is something about this pandemic making him seem like a more serious person?
I was going to go there. I agree with everything Jenni said, and that be the full. What she said may be the full ambit of the implication for him as a political commodity. But I have a feeling that this time has also diminished his vulnerability to the consistent and persistent criticism of him as, an actor, as a presenter, not just a politician, but more of a presence and a brand. And that it has added, particularly in light of the difficulties that he had to go through with the blackface scandal during the campaign, the brownface scandal, whatever you call it. I think the consistent daily newser, where he has to stand there for 40 minutes and answer questions on international relations in China, on the supply of medical supplies, on what's happening in terms of the relative reopening regimes in Saskatchewan versus New Brunswick. I mean, it is, if you take a look at them, the accumulated policy ground that's covered in those daily question and answer sessions with media, it's pretty vast. And so I think that compounded with the policy solutions that have come forward, I don't think it's, suddenly turned the guy into something that he wasn't before, but I think it's probably fairly significantly diminished his vulnerability to that charge of, that guy's a lightweight. I mean, we'll still hear that from the haters. I don't think that was ever, frankly, valid. I think that was a stupid thing for people to say because they were really encouraging low expectations and underestimating him. But I do think he will emerge from this much less vulnerable to that charge, and I think it would be a big mistake for people to go back to that well thinking that there was going to be plenty of water in it.
By the way, I'm watching this food processing business and reading a little bit about the agricultural food chain. One issue that I would be watching as a sleeper issue to get all these governments in trouble is food prices. The food supply chain is breaking down, and it's going to have consequences for not just the availability, but the prices of meat and other products. That's the kind of thing that gets governments in a lot of trouble.
Oh, 100%. I agree. These are going to end up being, this is what I'm talking about. It falls into the consequences of what we're going to see in the next 3 to 4 months. That's when prices would rise. And then if we have the increased level of unemployment in Ontario, it's projected to going to be close to 11% by the end of the year. And that's just if things stay the way they are now. And that goes into also the side effects, or the not so side effects, I should say, of what this pandemic is. So there's been so much focus on actual COVID itself. We've talked about this. So you have people who are not having elective surgeries, including cancer and cardiac surgeries in hospitals. You have people who, it's just the isolation of being by themselves. But if food prices goes up and you have, half of your population on government assistance, it means that people will eat less. People eat less healthy. The more money you have, the more healthy you can eat. And if we see a spike in food prices, especially among the state, like meat and vegetables and what have you, it means then you're going to have the health ramifications of people not being able to afford to buy good, nutritious food for their families.
Yeah. I agree with all that. And joking aside, not even being a slightly bit glib, I'm being quite serious. The more we talk about this, the more I actually start to think to myself, maybe there ought to be an election this fall. Maybe if I was in the Prime Minister's office, I would start to say we have to settle some big issues and address some big issues, and it merits an election to gain a mandate. You still got to navigate that political issue that we're talking about, but boy.
Well, there's got to be a real issue.
There's trouble ahead.
There's got to be a real issue.
But he has, for him, it's the harder thing to justify is that all the initiatives that he's announced, it's not like he's announced them seemingly with support from the opposition parties. So he's going to have to come up with something different, because he can't say, well, people have been receiving the CERB for 5 months. We've got, what is he going to run to extend it another 6 months? Like those are things he could do. I think that would be disastrous, but I don't think he can campaign on what's already been announced that Parliament has approved. I think the provinces, I think if premiers wanted to go to the electorate, I think fundamentally the decision that provinces are making seemingly have a much bigger day-to-day impact on the lives of Canadians.
Yeah. Well, I agree with that. Obviously, you can't go to the electorate unless there's
one issue could be one issue could be the recovery.
Yeah.
What was that, Scott? I missed it. Sorry, I was talking over you.
I was just going to say the same thing. I mean, fundamentally, you've got to go to the public and say, there's a decision that's required from you as an electorate, because there's a division of view on how to proceed. But I think there will be a division of views on how to proceed, and I don't think that has to be artificially constructed. I think that will be naturally constructed coming into the reopening and recovery phase of this. So just as you're probably, I think, where you were headed, David, which is the recovery may actually be the mechanism that forces political difference in a way that we haven't witnessed in the last number of months.
Well, I noticed that Scott Moe, who along with Larry and Curley chairs the Council of the Federation, or whatever they call that thing, with the premiers, saying last night that they didn't. Shemp was pretty funny. Saying last night that premiers were getting pissed off about the lack of consultation with the federal government. Federal government was announcing all these programs without consulting them, and then he went on to say, and we're not interested in their ideas about how to get the economy back on its feet. We've got a bunch of shovel-ready projects here in Saskatchewan, and we want money going into shovel-ready projects. Well, Scott Moe has obviously not heard about the She Session, and obviously not heard that the jobs were not lost in manual labor construction jobs, but the jobs were lost by women in the service sector.
Well, okay, to be fair, he actually didn't say, we don't want your money, we don't want your ideas. What he said was that programs like the wage subsidy were announced after having calls with the premier. So basically, Trudeau's on a call with the premier, doesn't bring it up, and then goes out and announces it, which is not...
sounded weird.
Which is not very much in good faith in terms of talking to the premiers, especially since a lot of these programs being announced have a provincial component to the wage subsidy for the rent subsidy, for example. But in terms of, if you look at the numbers,
and that misses the point.
But there is. Listen, we've talked about this. There are going to be some stimulus that is going to be similar to 2008 and 2009, but the vast majority of it is going to be different just because of the nature of what the job losses have been. But if you looked at the latest numbers, the proportion between men and women in the country really shrunk when the latest numbers were out. It's somewhat, I believe women are just slightly above the job losses now than men. When we were talking about this like 3 weeks ago, it was more profound. But as the people have lost their jobs in the last month, it's starting to even itself out. So
but the construction jobs will bounce back easier than the service sector jobs will anyway, though. Like I don't know how, if you're working the restaurant business or if you work in the retail business, I don't know how quickly those kind of jobs are going to come back. It doesn't feel quickly to me.
No, I agree. I'm not saying it's not a problem. I'm just saying, yeah. But there are men that work in the retail and service industries as well.
But I also think, moving away from the She Session issue for just 1 second, I think we are beginning to see a shift in the Fed-Prov aspect of all this. I think that the Feds probably have, after probably in my perspective, being possibly a little too deferential to the provinces in the early going. I think now they have probably taken the view of we're not going to necessarily paralyze ourselves in that fashion. And I do think you're going to see that compounded with natural political and policy differences of opinion start to increase tension. I think you're going to start to see a little bit more of a clash. You're going to hear the resistance is alive. It's just been quiet. And I think we're going to hear the resistance resurge its voice.
But I think but that's fair. There are going to be fundamental differences between levels of government, and frankly, as I've said before, there are legitimate questions that people should be asking of all politicians, all leaders now about where we are in terms of this phase of lockdown and opening back up. And I think it's more profound for I think it's more profound for Ontario because they do remain so far behind other provinces in terms of their planned opening up of society. So people in like our Ontario listeners will probably understand more what we're saying.
But this is the connection to the point we were making earlier. And I know we want to move on, but when we were talking about the polls and how the polls are probably inflated, one of the things you have to be careful about, federal and political leader at any level, is be careful not to believe your own bullshit, right? Don't drink your own bathwater. Whatever you do, don't drink your own bullshit. And, I think you just got to be a little careful as we move into this next arena saying, I've been looking at the polls. I'm pretty bulletproof. My decisions are going to be A-OK. There'll be some division of opinion, but I'm going to be golden on this. And we could see that stuff collapse, right? And we could see people take firm opinions.
Have you been rereading Juggernaut? Is that what prompted this?
No, I will never reread Juggernaut. God bless Susan Delacourt, but I will never lay my eyes on the inside of that book again. It's a scar that will not heal. It is a wound that shall not close.
I agree with you, Scott. I actually think politicians will believe all of this to their detriment.
Jenni, I'm going to put you on the spot, but it's a legitimate opportunity. I'm going to give you as much space as you want. Okay?
Jeez,
we got a viewer mailbag question that asked you to explain why you think Trump is going to win the election.
Well, I think I've stated it before. I think that in no particular order, I think that pre-pandemic, at least, the American economy was doing very well. I think obviously the last 2 months have changed that, and I think that he will be judged more in terms of as the states start to open up and the focus turns to the economy, which I think has ultimately been his focus almost from the get-go, or at least you can tell there was thoughts. He was talking about it in his pressers earlier on than probably any politician. And frankly, I've said this before, for Canada, for us in Canada, we should hope that the American economy is as strong as it possibly can be. I also think he's lucky that the Democrats completely missed an opportunity to elect someone that was not 85 years old. I think the fact that you had two old white men be the front runners, and you're looking at the spry 83-year-old Joe Biden as your nominee, I think is a absolute plus for Trump. Like the fact that people openly talk about Bernie's got to pick a running mate that could possibly take over because he could die in office. Like that's people ultimately are talking about that, and I just think it was a really irresponsible choice by the Democrats to elect to not elect someone demographically that would be better for them.
I just want to say, even in these grave and serious times, I intend to spend every single one of those $1,000 I'm going to win off of you on frivolous crap, okay? It's going to be comic books and mixed drinks and fancy cigarettes that come in holders. Like, I am going to blow every penny of it. He's going to lose. And I think he's starting
idea.
to move in a direction of getting a colossally thumped, because this thing really starts to feel to me like it is exactly the campaign he didn't want, which was a referendum on him. As long as it's a mix of issues and he can put the onus on the other guys. And I agree there's lots of vulnerability with the Biden candidacy, but so far they've been smart. He's been locked up in an ice hut somewhere and just let Trump blow his brains out on a day-by-day basis. And there's lots of time to election day, but boy, I think Trump has put himself in a very vulnerable spot. I think the macro factors that are moving around right now politically really disadvantage him. And I think he's starting to look, it sounds silly talking about him, but I think he looks unhinged. I think he looks incoherent. I don't think he has a persistent message, which even in his worst of times he generally had. I think it's a world of fucking trouble for that orange-haired freak, and I'm going to love watching him go down.
You're so wrong. I maintain I'm still going to win this one. And frankly, part of the reason Biden hasn't been out and about is he falls into the most vulnerable category of people that could get COVID.
I just want to say, for my part, that I don't know whether he's going to win or lose. My rational brain says he's going to lose, but I fear that that's wrong. But I think every day it strikes me that it's more urgent that we get this man out of office. This thing this week where Attorney General Barr dropped the charges against Michael Flynn. This is what happens in banana republics under dictators, where the leaders' friends the rules don't apply and they're impervious to
you agree,
legal consequences.
So like the Clintons.
This is unbelievable. This is like, if we had another 4 years of this, I don't know what American democracy is like.
You can't play whataboutism. Come on, Jenny. There's nothing comparable.
The Clintons' friends never skirted the law. Come on. You guys are just, you said rationally you can't see him winning. You guys cannot be rational when you talk about Trump.
I'm sorry. You got to be kidding me. This Michael Flynn thing, I don't like the word corrupt when people talk about politics. I think it gets flung around very easily, and it's a horrifying charge, and it is very, very rarely accurate. But this regime is literally corrupt, and this is inescapable evidence of it. Like, Barr withdraws the charges on the basis, what's the Attorney General do? He withdraws the charges on the basis that a conviction is unlikely. That's what an Attorney General's charge is. Like, no, we're not going to proceed because a conviction is unlikely. He pled fucking guilty. It's not, the guy's guilty by his own confession. His signature is the evidence that he will be convicted. And the guy says, you know what, President Trump doesn't want him convicted, so I'm just going to withdraw it. It is indefensible. It is corruption. It is an abuse of power. And all this other stuff that makes me mad, it is what it is. But that's an overt abuse.
Viewer mailbag. Justine, who would appreciate not having her last name mentioned on the pod given her job, says.
Do you know her last name, David?
None of your business.
All right.
As a public servant, I am curious about each of your perspectives on the true relationship between the political and the public service. Example, how much did you rely on the advice of public servants versus pushing them to action? Did you actually find a liberal bent in the public service? And how much of a tension between public service and political levels is healthy? Jenny, you want to go with that first? Yeah, sure.
I've had the pleasure of working with some great bureaucrats over the years, federally and provincially. Some not so good. In terms of a liberal bias, I don't think I would say that. I think bureaucrats, for the most part, have their own bias. They want to add layers upon layers upon layers to very simple things. And I think that, but I'm not saying it's a liberal. I'm not going to say it's a liberal bent. I did know, in terms of relationships, there was a much more professional relationship I found in Ottawa. The Prime Minister met regularly with all the clerks that we had. Sometimes almost on a daily basis, especially if we were located in Longevon, because of course his office is on the second floor and the clerk's office is on the third. It was a bit of a shock to me in terms of the informal relationship that bureaucrats had with us going into Queen's Park. Like, for example, the secretary at the time, Steve Orsini, I remember being in my office in the first month that we were in government, and all of a sudden there was a knock on the door, and he just came in, and he had swipe access to the Premier's office suite of offices, and that was just something that never would have happened. You never would have saw the clerk, Wayne or Kevin or Alex Himmelfarb at the start, just kind of wandering the halls of Longevon, looking to chat.
No, Himmelfarb would have been trolling Darcy McGee's and Highs looking to chat.
Yeah, that's right.
Yeah.
Wandering the market. The laying down slag.
Hey, you guys were the ones that asked us to appoint him to Italy.
Yeah, no,
it wasn't Scott or I.
No, I didn't sign my name to that goddamn piece of paper. Anyway, I think this is a really interesting subject, honestly, and probably most people don't. But I think it's that interface between political staff and senior public servant. I think that it's a kind of a crease of government that gets unexamined a lot of the time, and it's really important. And first of all, I don't really detect a liberal bias among bureaucrats. I don't really. I don't buy.
They are a peculiar creature that is nonpartisan in any way. And it's always reflected in this. When you're in government, the deputy ministers cross the street to run into you. And when you're in opposition, they walk across the street to avoid running into you. This is what the deal is.
That's right. And that's right. That's the way it ought to work in many respects.
And there are exceptions. There are exceptions. There are bureaucrats we could all sit and label that, they worked for my team at one time. And then, very well-known liberal. I'm talking generally about the majority of bureaucrats.
I guess my general view is it's no such thing as a monolithic definition of bureaucrat. It's not. I think it's unfair to generalize. I'll tell you a quick story, though, that highlights where I think that interface matters, and was a core rule of thumb for me when I was in government, which is, we were a month and a half into government in the Prime Minister's office when the Mahar affair was forcing the question of whether or not there ought to be a judicial inquiry into it, or there ought to be a formal inquiry. And we eventually appointed Justice O'Connor to do a review of that matter. And I can recall being called into a meeting with very senior bureaucrats across the security, defense establishment, all of that, and being really laid into and pressured to advise the Prime Minister against doing it. And the fundamental arguments that were being made was, look, you guys are just in office. I know you got a lot of political balls to juggle here, but just understand, this stuff is really important. We're talking about the sharing of Five Eyes intelligence. And, if you want to think about it, the politics of it actually plays this way and that way. And I left that meeting and I thought to myself, first of all, I feel patronized. Second of all, if you're going to make an argument to me on the basis of what the policy imperative is. Leave the politics to me. Maybe I'm a chowderhead. Maybe I'm a fool. Maybe I will run this government's politics right into the lake. But that is still my competency, at least as it's supposed to work. And I don't want to be told, you should be doing this because you haven't considered these political angles. No, give me an argument that you think has substantive merit, and then we'll lay on top of it the political dimensions. I might be happy to have that discussion with you, but don't tell me that this policy ought to be motivated by political considerations. I'm not going to like that.
100%. And that's the difference. And we've talked about this. The bureaucrats, I think just to aggravate me, when we were always having discussions on Omar Khadr, would refer to him as young Omar in briefing notes and in meetings. And my buddy Ali Ken Velshi and I, it would inflame me to the point, we would be like, BBMing each other during meetings about young Omar. But this is kind of what we've been talking about, and we've talked about this before, is that I think politicians have basically given all decision-making seemingly to bureaucrats and public health officials over the last 2 months, and that has to end. It's not their job. To Scott, your point is the health officials are there, the bureaucrats are there to give advice and to tell us what the different policy outcomes could be, what the ramifications could be, but it is not their job to make decisions about the province opening up or what have you.
Excellent. Listen, Justine, great question. We could have gone on about this longer, for sure, and maybe we'll return to it in subsequent episodes. Jenni, Scott, I love you too. Thank you for being here with me again today. You're helping me get through this pandemic.
You're my best friend.
Thank you, everybody, for listening. Thank you, TELUS, for being our presenting sponsor. Thank the Air Quotes Media team for putting all this on. Go to iTunes and give us a rating if you can, or say something about it on social media if you like this episode. And we will see you in 1 week. Stay safe. Be careful. Bye-bye.
Bye.